We created a case of an older adult, a lady called Miriam, and we wanted to show Miriam's experiences of her life before she was diagnosed with Alzheimer's, to understand the person and not just the person with the diagnosis. So we used a program called Timeline.js. The nice thing about using the timeline is that you can also add in videos and you can add in voice recordings.
Miriam has strong recollections of her father. His name was...
It was a really powerful way of being able to show somebody's life through all the stages and not just focusing on what it's like to have a particular illness or a particular disease.
We're using a case study based approach to help the learners sort of feel that the cases we're discussing are a bit more real and they can put some of the theory into practice. And with that we decided to use avatars who the students could hopefully relate to.
Been at uni for a couple of years doing business studies. I've just gone into my final year, but I'm not sure if I can carry on.
They're quite useful that you can show development over time. So the idea will be that the avatars that we've introduced this year, they'll use again, say in year 2 and year 3, and perhaps the avatar will age or various things will happen with them. So there'll be different issues for the nurses to sort of to deal with.
Since I started on those blood pressure tablets.
Well, we can compare your last reading. Try to relax your arm.
I see great value in the use of TEL to the midwifery students I teach. TEL activities are accessible 24 hours a day, and so learning is not just limited to when the students are on campus. Activities and content can be easily accessible from their mobile devices, iPads, mobile phones, laptops.
I use Turningpoint, which is a system where the students come into the lecture or seminar and they have little clickers and you can ask a series of questions through the PowerPoint. Students respond on the clickers and then their answers come up on the PowerPoint. I wanted a way really to engage students more, so I wanted something a bit more interactive. I had quite a lot of feedback afterwards to say it was a good method of keeping people much more engaged. It was a bit more fun. A bit more interesting. People were discussing the answers and then it's interesting to see what other responses are.
The learning outcomes were trying to get students to realise decision making was influenced by the situation that they would encounter. So I used YouChoose, which is an online platform hosted here at UE. A patient was devised who had particular characteristics and diseases. The students were assuming the role of the care provider and had to decide how they would manage this person's case and his outcomes. Student feedback was really positive. They liked that it was interactive and the person's condition changed depending on the decisions they made, and they wanted access again later in the module to review it as they developed their thinking to see if they would still make the same decisions.
Very busy out there, I couldn't find a seat.
We do have to think of a real menu of ways to articulate the same thing so that when you're working within and across branches you have got that diversity of approaches so that different people with different needs and different learning styles and even different cultural backgrounds can access the same information but in different ways.
I actually think everybody should use technology in their teaching and learning because it pays rewards and the students enjoy that chance very much to engage with something different.